You are officially invited. Yes, you're invited to join us in Fertility Awareness Mastery. This is my 8-week program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start the first week of May. Are you ready to jump in? Head over to fertilityfriday.com/FAM, as in Fertility Awareness Mastery, to register today. That's fertilityfriday.com/FAM. Today's episode is brought to you by Conceiving with Fertility Awareness, a free online course designed to help you utilize fertility awareness strategies to optimize your chances of conceiving naturally. From timing sex accurately every time to identifying potential fertility issues through charting, this course has you covered. Head over to fertilityfriday.com/TTC for access. TTC as in trying to conceive. Again, that's fertilityfriday.com/TTC. This is the Fertility Friday podcast, episode number 305. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Journal. I'm a certified fertility awareness educator and holistic reproductive health practitioner with nearly 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormonal health, and optimizing the menstrual cycle without hormones. I'm outspoken about hormonal birth control and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys. I know, I'm a busy girl, but I managed to fit it all in. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with us today. Today, I share my interview with Dr. Mary Samplaski, and I reached out to Dr. Samplaski because she specializes in male infertility and in particular varicocele, a common issue that does impact male fertility. And so in today's episode, we really get into it. What is it? How does it affect fertility? Is it treatable? How is it treated? What does that look like? And just really great all-around information about male fertility challenges. So for anyone who's listened to the show, you'll know that I always stress the importance of having both partners fully investigated from the start when you're experiencing fertility challenges, because as women, we typically are quick to think that it's got to be me, there's got to be something wrong. And even sometimes our practitioners are hesitant to look into what's happening with the male partner. And so in today's episode, we really get into why it's important to have your partner evaluated, why it's important not to overlook it and not to make assumptions, but to really look at both parties when you're experiencing fertility challenges. So without further ado, let's jump into today's episode with Dr. Samplaski. And I'm really excited to welcome Dr. Mary Samplaski to the show today. Dr. Samplaski is a fellowship-trained, board-certified American Board of Urology expert in male infertility, and she's the director of male infertility, andropology, and microsurgery at the University of Southern California. She completed her residency training in urology at the Cleveland Clinic Foundation. She then completed a 2-year fellowship training in male infertility and andrology at the University of Toronto. And she's also done additional specialty training at the Miami Project in male infertility in the spinal cord injury population. So Dr. Samplaski is well-versed in male infertility. And in today's episode, we're going to focus on male infertility. We're going to talk about varicocele and how that can impact fertility and just really dive into the medical aspect of things. So without further ado, welcome to the show, Dr. Samplaski.
Thank you for having me, Lisa.
Well, I'm really excited to have you on the show and to just dive into the topic of male infertility. We were talking a little bit in the pre-chat. This is an area that I always focus on whenever I can in the podcast because I feel like our culture is always very focused on women and their role in fertility challenges. And much of the time, there is a male factor issue at play. I think just to jump in, I would love to get a sense from you, what inspired you to focus in the area of male infertility?
So it's definitely not sort of what I originally thought I was going to do. I always sort of liked surgical things. I liked sort of procedures. So that's how I ended up in urology. But then one of the things that I really found that I gravitated towards was, number one, the microsurgery aspect, but then also I just thought it was such a cool way to sort of help couples. There's a lot of, within urology, there's a lot of cancer stuff, but seeing a couple's face when they sort of either come in to tell you or send you the email that they finally sort of gotten there and that they're pregnant, it's just one of the coolest things to be able to sort of be involved with, to whatever capacity. So from a sort of professional fulfillment perspective, I think that was probably it. And then I also just thought infertility was unique in that there was a genetic component, there's a hormonal component, there's both male and female factors. So it was different from other sort of specialties where it's just like cut it out or take the stone out. And I found it incredibly gratifying. And then also the part of me that is a little sort of precise and wants things to sort of look right was really well suited for microsurgery, where when you're doing these like small, delicate operations and they sort of have to be close to perfect, that worked for how I like to operate.
Mm-hmm. Well, and for our listeners who aren't really familiar, could you briefly share the difference between microsurgery? I think you just basically did, but maybe in a bit more detail. So between microsurgery and then just regular surgery.
So microsurgery is done under a microscope. So the two sort of main surgeries that I'm referring to are varicocele repairs and then vasectomy or reversals. And so because these are such delicate procedures done on veins or the vas, which is only a few millimeters in size, and our human eyes on their own can't really accommodate to that level of detail to actually perform precise surgery, we actually operate under a microscope. So it's under about 20x magnifications. That's microsurgery. It's surgery done under a microscope, as opposed to open surgery or robotic surgery where the magnification is not enlarged because you don't really need to.
Wow, that's incredible. I can see what you were saying about being very precise, because under 20 time magnification, I mean, you must have the steadiest hands on the planet.
No.
So one of the questions that I wanted to ask is just in general to kind of establish the issue with male fertility challenges. And I'm curious, how common is male factor infertility?
So infertility in general affects about 15% of couples, but of those couples, up to about 50% will have a male factor component. So in about 20 to 30%, it ends up that the male is sort of the primary, I hate to say cause, but the male is sort of the cause of why they're struggling. And then about 20 to 30%, there's overlap between female factors. So there's both male and female factors at play. So it's, I think the females sort of tend to get focused on initially because they do play the larger proportion. And, obviously they're the ones that are carrying the babies, and oftentimes they're the ones that are driving the fertility wants. But the reality is up to 50% of cases will have a male factor component.
Well, and it's been the experience of a lot of the women I've worked with over the years, just in general, that, even if their partner is tested and the sperm values or the, sperm parameters are a little bit on the lower end, they're often told that their partners are just fine. I'm curious if you have an opinion about that, or if you've had just some experience with how it is determined whether or not there is an issue on the male side.
I would definitely agree with you. I think a lot of it depends upon where these guys are initially screened. So the family doctors, or if it's a reproductive gynecologist, I think, the family doctors, because they don't sort of specialize in male factor infertility, oftentimes they get a semen analysis with a list of normal reference values. But, just because somebody sort of tests normal, there still might be things that can be done to sort of make things a little bit better. So, I always tell guys more sperm or more swimming sperm ultimately is more sperm swimming at the egg every month. And the reproductive gynecologists, they actually sort of see, I think, a lot of these. We know this now, that there's good data that the reproductive gynecologists end up seeing a lot of these guys first. And so oftentimes they do refer the men for a male factor evaluation. And I think it's, they're sort of supposed to, per practice guidelines, when infertility is suspected, both the male and female partners are supposed to be worked up in tandem, just because there might be things that we can do to improve a male's infertility, because the semen analysis is sort of the best test that we have right now, but it's not perfect. There's plenty of guys who have normal semen analyses who still, the couple still are not achieving their reproductive goals. And then that sort of brings to light sperm DNA damage, which is a concept that is still sort of its role in infertility is being sorted out, but that's not seen on a standard semen analysis.
Well, I want to dig into that a little bit, but I wanted to just touch on a little bit on the idea of normal, because as you were talking, you mentioned that there are times when even when a man is quote unquote normal, there would still potentially be things that we could do to improve those numbers, because as you said, if there's more swimmers, it's just a better chance. So I would like to hear your take on what's normal. My understanding is that those normal values have changed multiple times. The World Health Organization declared what is normal in their first edition. The name of the exact document escapes me, but the document where they basically outline the sperm. And the first edition in 1980, and then there's been 5 editions since. And so those numbers of what constitutes normal have gone under significant changes. So from your perspective, then, like the current standard of what is normal, do you feel that if a man just meets those parameters just there, that it is actually fine, or what have you found in your practice?
What I tell couples is and it's true, but couples don't care as much about a normal semen analysis as much as they do about getting pregnant and ultimately having a live birth. So while it's great to have normal numbers on paper, ultimately what couples want is a take-home baby. And so the normal that we're currently in the World Health Organization 5th edition, and the normal parameters are volume more than 1.5, concentration more than 15 million, motility more than 40, and morphology more than 4%. But more sperm in any of those classes is probably a good thing. But I also think, particularly in reproductive medicine, I think there's a lot that we don't know. I mean, the reality is all we're doing is looking at sperm under a microscope. This is nothing about their genetic health or how they function. So, in terms of and this sort of leads into the varicocele discussion, but I personally think there's several underlying genetic conditions that medicine just is not aware of, that we don't have tests for, but ultimately will impact a couple's fertility potential. So I think the semen analysis is the best we have right now, but if a couple isn't achieving their goals, even with normal semen parameters, it doesn't matter quite as much because they're still not sort of getting what they want so badly.
Mm-hmm. Well, and so for the listeners who aren't familiar with sperm DNA damage and what that means and how that can impact a couple's chance of conceiving, did you want to dive into that a little bit? I suppose one of the questions that I have about it is if a man's sperm parameters are on the lower end, does that correlate with an increased, chance or an increased amount of sperm DNA damage, or do we know?
To answer your question, yes. So the concept of sperm DNA damage is, even in guys, so some guys will have normal semen parameters, but for whatever reason, they're not achieving a pregnancy, or these couples have had recurrent miscarriages, despite sort of all things seemingly being accounted for. So the concept of sperm DNA damage is that when sperm are forming and splitting and creating new sperm, dividing, there's a series of breaks that occur to sort of allow the double helix to split. And then when a new sperm is formed, these breaks sort of seal up. But in guys who have unexplained infertility, or even guys who do have borderline semen analyses, these guys will have more breaks. So one of the more common tests that is done is called the COMET assay. Basically, they put sperm in a gel and they apply sort of a electrical current, and the heavier fragments don't move as quickly as the lighter fragments, and so the comet forms a longer tail. So for those guys, they have more DNA breaks, and they tend to fertilize naturally at a lower rate, and then those couples tend to have lower success with artificial or assisted technologies such as IUI and IVF.
So it sounds as though there are some men who then would have a sperm analysis done and it reads normal, but they're potentially, if they're at the lower end or if they're borderline, as you mentioned, they would then potentially have a higher level of this, damaged DNA sperm, which would then potentially reduce the likelihood of them conceiving within a certain time frame. Because it's my understanding I think, so correct me if I'm wrong, my understanding is that one of the challenges with identifying male infertility is that there is obviously a line in the sand. Like if you have no sperm, then, if
Right.
you have a condition, then obviously there's a line in the sand. But if a man does have sperm, even if the numbers are very low, there's always this chance that conception can happen. Whether it's going to happen in a timely manner is another question, or whether multiple miscarriages are going to happen before it happens. But I feel like that's one of the challenges that I've seen. And that's one of the reasons why a lot of men are being classified as normal and fine, because there's always this chance. As long as there's sperm, there's always this chance that the conception will just...
Yes. Yeah, and one thing I just want to mention that I think I get asked a lot when I see these couples is people who have these DNA breaks. The female body, this does not necessarily correlate with sort of offspring or babies that are more sick or have either handicaps or mutations. The female body has this amazing ability to sort of screen out embryos that are not normal. So, even if a guy has more of these DNA breaks, it doesn't necessarily mean that they're going to have a baby that has issues down the road.
Mm-hmm. Well, so one of the questions that I've kind of formed over the years is that in the way that the testing on males is done, it seems like there's very much kind of like this line in the sand where it's like either you're normal or not. And there's not a whole lot of discussion about like suboptimal versus optimal, if that makes sense. So there's this line between normal and not, but a lot of men in the normal category still have an issue getting pregnant. Did you have any, I'm just curious what your thoughts are on that, or if you found that, and how you counsel your couples about that.
Yeah. So when I see, so we always go through with couples, we'll go over their semen parameters, right? And sort of, there's a wide range. So the lower limit for sperm concentration for what is considered normal is 15 million. But, guys can go up to 150 million. So what can we do to sort of help them have more? But then there's also all these other things outside of just the raw semen analysis. So varicoceles, I think varicoceles for some people affect sperm in different ways outside of the semen analysis. But then also all kinds of lifestyle things that we can sort of optimize. Cigarettes, marijuana, hot tubs, testosterone. There's a lot of people who think that testosterone replacement is just sort of a natural supplement. It's not. That can hurt sperm. Occupational exposures, and then just sort of optimizing sort of diet and exercise. There's evidence that exercise and diet can impact semen parameters. And again, I personally think that a lot of these small changes, even if the semen analysis is normal, they're going to provide healthier sperm. And so we always start with the semen analysis, but then we sort of go into all the other things that may or may not contribute to healthy sperm, which will hopefully contribute to a conception. And ultimately, in some couples, you will get to the point of, okay, you're doing everything right, and I don't know why this isn't happening. But at least we've sort of had that discussion. And I think in a lot of guys, we do find things that we can sort of slightly modify that hopefully will help them achieve their goals.
Mm-hmm. I really appreciate that because it goes a lot deeper. So the experience that your patients are having with you in many ways is different than many of the women who I've worked with, their experience with their doctors. Because a lot of women who are in the situation where potentially the partner's sperm parameters are borderline are often told that, there's not a whole lot that they can do and just immediately directed to artificial reproductive technology. So it sounds like your experience has kind of led you in the direction to at least attempt some of these things and educate the couple about these things.
I mean, I think most of my couples don't want to use assisted. They don't want to use help. I mean, I think like most people don't. Like they want to have a baby naturally, and I think that's normal. And so I would ask people what their goals are, but I think a lot of people don't feel don't feel comfortable with it. I mean, there's a lot of stuff that goes into inseminations and ART, and it's also just expensive. A lot of people just can't afford it for something that's not a guaranteed to work.
Mm-hmm. Well, let's jump into varicocele. So that's something where a lot of women who are in the situation where their partner's semen has been analyzed or their partner's had a full workup, that there's a certain percentage of couples for whom this is certainly an issue. Maybe you could share with us what it is and the link between varicocele and male infertility.
Sure. So varicoceles are dilated veins that drain the testicle. So, testicles are sort of unique in the male body in that they really don't have a whole lot of muscle backing. So these veins have a tendency to stretch. And when they stretch, the small sort of valves that keep blood moving completely against gravity sometimes don't sort of completely connect. So you get a pooling of blood around the testicle. And this is oxygen poor blood. And in some people, this pooling of blood, either by the sort of fact that it's oxygen poor or the fact that it's just heating up the testicle, can hurt sperm production or testosterone production. And for some people, the testicle takes the extra heat just fine, and it really doesn't seem to impact sperm production. And then for some people, it seems like heating up the sperm factory testicle does not work as well. Varicoceles we see them much more commonly in the infertile population. So they're seen in about 15% of the general population, but in couples with primary infertility, so these are people who have never had a baby, we see it in about 35% of men. And then in couples who are trying for a second baby and sort of struggling, we see it in about 80% of those guys.
Mm-hmm. That's something that I actually saw in the research, that this connection in secondary infertility. Are there any theories as to why that is? So secondary meaning you've had a child previously and now you're going for, or several, but you're going for a child after you've already had one. Do you have any idea why it seems to affect men more the second time around if they had it before?
So medicine doesn't, we don't actually know why. I personally think it may just be sort of that, I hate to say wear and tear, but that, guys, these are people who have, been around longer and who have been upright for longer and exercising and picking up kids and doing things that sort of exert pressure on these veins, and ultimately these veins sort of stretch. But we don't have a great reason why some versus not others.
Well, and when you were describing it, so these veins then increase the temperature of the testicles. And so there's some theory as to, maybe you could just share with us the importance of temperature as it pertains to sperm production, and so that everyone kind of has an understanding of how, if the varicoceles are actually increasing the temperature, why that would negatively affect the sperm.
So Testicles are outside the body, we think, for a reason, to keep them 3 to 5 degrees cooler than inside the body. And this is part of why people who have undescended testicles when they're little boys when they're kids or babies, why those people sometimes struggle to have kids. Because testicles need to be cooler. The sperm production factory likes to be a little bit cooler, and when it's hotter or when it's warmer, for some people it seems like testicle doesn't work as well.
Well, and you mentioned hot tubs earlier as one of the things, and I think that's a common thing that a lot of people have heard about, but I often wonder if people just think it's an urban legend. There's actually some truth to that because sperm have to be produced at an optimal temperature.
Yeah, and I think, what I always tell people is it's not everybody, right? I mean, there's plenty of people who use a hot tub and go on to fertilize without issues, but there's plenty of reports of people sitting in a hot tub for half an hour and having a decline in their sperm count. And so if you're trying to have a baby, it's sort of, I tell people, low-lying fruit. It's the easy thing that you can do that may help you to sort of get where you want to be.
Mm-hmm. Well, and so back to the varicoceles. So then if a couple has been trying to conceive and it's not happening, then because with the varicocele, would a man know that he has it, or does a doctor have to look at him and do an examination in order for this to be identified?
So in general, it's sort of best to be examined by a physician just because you sort of want to catch other things like testicle tumors. But there's a lot of guys who come to my clinic who know that they have them. The internet provides people with pictures. Guys are looking around down there. And so there's people who say, like, yeah, I know I had this. It doesn't bother me. And so I never did anything about it, which is like totally reasonable. But there's also a lot of people who you can't see them. Some you can see and some you cannot. And so there's plenty of people, when I examine them, I'll feel the veins distend. And so that would have only been diagnosed by a reproductive urologist.
Well, and so I think this kind of gets back to the conversation that we were talking about before. So if you have a couple who's not conceiving and their test results are running normal, if their doctor is not, well, and then there's a lot of couples who aren't tested. And I spoke to women who they're not conceiving, but maybe they have to even try to convince their doctor to analyze their partner's sperm. But so for the couples then who aren't conceiving, if they haven't even done the semen analysis, but if they have done it and they're just, listed as normal, you mentioned that the standard of care should be that men are referred for a workup. It sounds like this would be one of the reasons why your male partner should have a workup, just in case, because this is just one of the things that could be identified in that workup.
Yes. I mean, there's so many men who I've seen who have varicoceles, and we've been shown to sort of fixing them. And again, this is not everybody, but in the people who are trying to have a baby, who have a larger varicocele, who don't want to move on to more aggressive technology assistance, or invasive is probably a better word. Fixing these varicoceles can help them to, the goal is usually to have a baby on their own.
Mm-hmm. Well, and so then how do you fix the varicocele? So, a lot of women ask about the surgery and is it going to work, and how does it look? Is it going to hurt him? How does it impact him? Maybe you can kind of walk us through what the treatment options are and how it actually is, the kind of realistic day-to-day stuff of the procedure itself, and then also if it how it does it actually improve the sperm quality afterwards?
So there's in general two main ways that we fix varicoceles or repair varicoceles. The microsurgery is the one that I do. And then there's also a radiology procedure where the interventional radiologist can put these little plugs, and that's called in the veins, and that's called embolization. The microsurgery, it's a relatively small surgery. It is surgery nonetheless. It takes about 90 minutes. The guys go to sleep. Mostly because they're just too difficult to do awake, and the movement of sort of the shifting under a microscope looks, a lot bigger. It's like an earthquake. But I think most guys are happy to go to sleep. So we basically identify the dilated veins under a microscope, and we use a small ultrasound. And the tip of this ultrasound is about the size of a pen tip. And so using the ultrasound, we can identify the direction of blood flow. And so we identify the dilated veins, and we tie them off so that the blood is essentially forced to drain through healthier veins. So I sort of tell people it's a little bit like if a road isn't working, you block it off, and cars are forced to drain through a healthier route. Guys go home the same day. Most people use ibuprofen alone for pain control, along with ice packs and scrotal support. And most people say it was not that bad. They're back to work in maybe 3 days. I tell people to wait a few weeks before going to the gym. But certainly there's the fear of the unknown, the small surgery, but it is a surgery. But most people afterwards say that was not bad. And ultimately, if it helps couples get where they want to be, most people's guys are sort of fine to be a part of it.
I'm sure that someone's thinking this, especially if there's a woman who, I'm sure there's some women who are listening to this right now because the episode was titled, varicocele, and they're in the midst of making this decision. How long until you can have sex again?
I tell people 2 weeks.
Okay.
2 weeks, just for, what I don't want is sort of something to get bumped and a lot of bruising. So 2 weeks usually works. And I tell them in the pre-op area. So sometimes there are people who will sort of schedule things around their ovulation. I think that makes sense.
Yeah. Yeah, that's helpful to know. Yeah, definitely. Well, and so once you have the procedure done, like anything in life, I'm guessing that, 2 weeks later, it's not immediate. All of a sudden, his sperm count has doubled and morphology is, now 100% when before it was 2. So I'm sure everything isn't just amazing immediately, but share with us how it looks in terms of how long does it take for you to see those improvements in sperm quality, and does it work for everyone?
So varicocele repair will improve semen parameters in about 60 to 70% of men. So it's not everybody. And also varicoceles come in small, medium, and large varieties. In general, larger improvements are seen for bigger veins, which sort of makes sense. Sperm production takes 3 months. So the assembly line for making sperm takes 3 months. So any change that we do, you will not see the total effect for 3 months. So what I tell people is, start trying because, the factory is still cooled off. And so there might be changes, there may be improvements in the sperm that are released after surgery that we don't see on the raw semen analysis. But in general, we check another semen analysis after 3 months. And that's really reflective of the new sort of cooler environment that the sperm are being formed in.
Mm-hmm. Well, I think the varicocele is interesting because, as you mentioned, there is a certain percent of the general population who has them. And then there's also a certain percentage of fertile men who have them. But it seems as though infertile men have there's a higher percentage of infertile men with varicocele. Am I iterating this correctly?
Yeah. I mean, I just think the more practice I'm in, the more I see this. Every person is different. So some people's testicles can take the heat a little bit more, and some they can't. And maybe with time, they are sort of less tolerant of the warmer temperatures. And people's bodies change over time. So, for some people it's a problem, and for some it's not. And maybe at one point it wasn't. And then, with time, it has become more of a problem for the sperm production. It's everyone's unique.
Mm-hmm. I think for any practitioner who's worked with many, many individuals in whatever area, you really can't stick to a template if you're paying attention, because there are general tenets of health and anything else, but there is this broad spectrum of individual difference that we have to account for. So in your experience then, couples who have issues with male infertility, who have varicocele, go through the procedure, start to see those improvements in 3 months. Could you just share with us a general idea of, are the improvements dramatic? Are they subtle? it obviously varies from person to person, but how do you share that? And then also pregnancy rates. Do you have any
Mm-hmm.
information just about all of that?
Yeah, so there's a couple sort of aspects to it. So to your point about the semen parameters, in general, guys with varicoceles, we tend to see improvements in all of the parameters. So count will usually improve, motility will usually improve, and morphology. And the degree of improvement is variable. I've seen people who have had a doubling or even tripling of their sort of total motile sperm count. And then I've had people who you see, maybe like a 50% increase. And is that, to your point, is that clinically meaningful? Is this meaningful in terms of helping them to have a baby? For some people, yes, and for some people, no. I tend to fix more of the larger varicoceles, particularly in couples who have sort of very low semen parameters, just because I don't want to subject people to a procedure that may not sort of help them to get where they want to be. But interestingly, there's a lot more evidence coming out now in terms of guys who have no sperm in their ejaculate. So these are guys, this is a really sort of tough diagnosis for couples to navigate. It obviously is really hard for the guys to know that they're not making anything. But there's more and more evidence coming out now that guys who have zero sperm and a varicocele, that fixing the varicocele may help up to 30% of those guys to have restoration of sperm to the ejaculate. So It's not a huge number, but for those 30%, that is a big deal for those couples. So it's always, in that population in particular, I tend to really sort of have a very frank discussion with them that, there's a good chance that this won't make things better, but if it does, we have just really sort of done a great thing for you.
Mm-hmm.
And then the last thing you asked about was pregnancy rates. And there's more and more evidence also showing that fixing these varicoceles can improve pregnancy rates and live birth rates. And to me, that sort of points to the DNA damage aspect, that we are providing healthier sperm to contribute to pregnancies that hopefully, result in beautiful, healthy babies.
I wanted to jump into today's episode to ask you a question. Have you registered for Fertility Awareness Mastery Live? This is my 8-week group coaching program, and it's designed to help you unlock the secrets of your menstrual cycle. Fertility Awareness Mastery teaches you everything you need to know about using fertility awareness cycle tracking to achieve your intentions, whether you're trying to get pregnant right now, whether you're trying to avoid pregnancy at the moment, or whether you're planning to conceive in the future and are kind of juggling the birth control side and also the preconception side. We have you covered in this program. Get to the root of your period problems, hormone imbalances, fertility challenges, and so much more. Head over to fertilityfriday.com/FAM, FAM, to reserve your spot today. That's fertilityfriday.com/FAM. Now let's jump back into today's episode. Mm-hmm. Well, you mentioned a few things that contribute to poor sperm qualities and parameters. You mentioned smoking cigarettes and marijuana and different, dietary things and how exercise can help and things like that. And maybe I just wanted to kind of go back there because what you mentioned as well was that often if you're working with a couple, there might be a few things that stand out that you can kind of touch on. So I'm just curious if you wanted to just go into that a little bit more, some of the reasons, because of course everyone wants to know why. Why are the sperm parameters so low? Why is that morphology number or that count number so low? What are some of those reasons? And in your experience, do you feel that some of these factors then are impairing that sperm DNA and kind of that's why, or I'm sure there's more to it than that. And we don't necessarily have all the answers, but maybe just talk to us a little bit about some of those additional factors that can damage the sperm.
Sure. I'm going to try and sort of answer your question the way that I think what you're trying to ask. So the other things that can sort of hurt sperm parameters outside of varicoceles that we know of, sometimes guys have lower testosterone. Testicle basically has two main jobs, to form sperm and to form testosterone. And so oftentimes, and sperm need a very testosterone-rich environment to form. So testicle actually has about 50 times higher testosterone levels than the blood. So the sperm really want to be bathed in testosterone. And so one of the other things that reproductive urologists do is oftentimes modify a guy's hormones, because if their blood testosterone is low, just sort of increasing their testosterone either with medications or lifestyle modifications, that can increase sperm counts or motility or morphology. And then just sort of other lifestyle things that we sort of touched on. Did I answer your question?
Yeah, you did. So a question for the women who are listening whose partner smokes cigarettes or marijuana. Is it like, if you have an issue with sperm, is it like he's got to go cold turkey, or how do you address that with your patients?
So in general, these things, to me, this falls under the umbrella of, I think cigarettes and marijuana can definitely hurt sperm motility and morphology. But I also think there's a lot of evidence showing that they can hurt the sperm genetic material. I think, if somebody is a very heavy user, I think it's really hard and sort of unrealistic, and sometimes can create a little bit of relationship stress for the sort of women to say, you have to stop this right now. Obviously, that would be ideal. But I feel like we have to be sort of gentle with our partners, and sort of, so usually what I tell people is try and cut down. If we need to, by whatever means that is. For some people, it's mindfulness. For some people, it's, endorsing another habit instead of using cigarettes or marijuana. Some people, will work with their primary doctor to sort of, they have these medications that can help with that. But I always encourage couples to be kind to each other. Give your male partner the support that he needs. Tell him good job for cutting back. There's actually no evidence looking at the different forms of marijuana and even tobacco. So it's a study I really want to do, but I just haven't been able to recruit men for. Vaping versus cigarettes versus chew. Within marijuana itself, people say, are edibles better than inhaled forms? I think so, but there's no evidence to show that. Certainly, like, there's less sort of inhaled things with the edibles. But you have to sort of be realistic with your partner. I think for those guys, it would be great for them to come off. If they are going to keep smoking cigarettes or marijuana, I always think a male vitamin or one-a-day vitamin is a good idea, just to sort of provide antioxidants to sort of find the bad things that they're inhaling. But you have to be kind to your partner. But yeah, ideally they would stop.
Well, I always find these conversations so interesting, because anyone who works with women in the fertility space knows that women will do everything. They will stand on their heads, do somersaults, and fly to the moon and back. They come in with this huge list of supplements. They're doing absolutely every possible thing under the sun, medical, holistic, all the things. And what I find is really interesting is that, so she's doing all of these things, and most doctors won't even necessarily say, well, at least get him on a multivitamin. And so I feel like the healthiest woman in the world, so she's got an amazing cycle, very healthy, everything. There's no doctor in the world that's going to say, well, you're so healthy, you don't even need to take a prenatal. Just go. But with men, we just don't even think, it doesn't even occur to us that maybe he should just do some stuff to prepare. Curious of what your thoughts are on that, and just what you've observed in medicine in general.
Yeah, so I think guys who are part of the couple who have seen a reproductive gynecologist and then come to me, most of them are on some supplements, these sort of male fertility targeted supplements. And those I don't think are bad. The evidence supporting them is sort of mixed, but what I tell couples is it is not going to hurt anything. I think I think there's different ways to look at this. In some ways, if they're on a supplement, I think it's sort of showing their commitment. But I will say, infertility is stressful for the men too. I've had numerous guys break down and cry when they're by themselves, saying, this is hard on me too, and I feel like I'm doing everything right, and it's still not happening. And I know this is sort of really hard on my wife or my partner. So I think in general, yes, infertility should be treated as a couple's condition. So both the male and the female should be seen, and lifestyle, which includes diet, supplement, exercise, regimen, healthy living, both should be addressed in both partners. But I'm also a big fan of relationship health.
Mm-hmm. Well, I really appreciate your perspective on that, because it's always a challenge to bring in your male partner into the discussion, because it can negatively affect the relationship depending on how you approach it. And I mean, at the end of the day, the way I look at it, you don't just want to have a baby, like you also want to have that family with your partner, right? So it's not just about bringing the baby into the world. One of the things that we kind of talked about in our pre-chat before we started recording was just about the type of doctor that you are, and your openness to your patients, looking at a more holistic approach. And so for the women who are listening who may have found themselves with a health professional, their doctor, who may not be open to it, or who may discourage them even from looking at different holistic options, I'm just curious if you could share a little bit about your approach, your experience, and what, if anything, you'd want them to know.
So I personally think that we know a lot about male infertility, but I think there's a lot about fertility in general that we don't know. I think medicine knows more today than it did 20 years ago, but I think we're going to know more in the future. So I'm a big fan, if it's something that couples are into or curious about, of a sort of multidisciplinary approach. Certainly, I'm trained in Western medicine, so I'm not a naturopath, I'm not a psychologist, but I think, in your fertility team, these are all things that can sort of augment your efforts. So, I've had couples go to a naturopath or a alternative medicine physician or provider, and seeing improvements, and that's great. I mean, what makes me happy to come to work is helping couples achieve their reproductive goals. So while it's not something that I'm trained in, I definitely think there's a role for other providers to be part of your care team. So I'm a big fan.
Well, and I mean, one of the things that you mentioned in our pre-chat as well is that although you have this open, holistic approach, which is a breath of fresh air, I'm sure, for your patients, not all doctors view it the same way. So given that you're a doctor and you would then know a lot of doctors, what, if any, advice would you give to a woman just for how to approach that conversation if their doctor's not necessarily as open to it as you are?
I guess what you could say is we're looking at working with a nutritionist. We just want to be sure we're leaving no stone unturned. Some physicians, everybody's different, and people come with different sort of beliefs of what their role is. But I guess you could say, you are our medical physician, but we just want to have a comprehensive care team. And I think it would be hard for anyone to not be in support of that.
Mm-hmm. Well, I appreciate that. And so, I mean, this conversation has just been so informative. I really appreciate you going through everything in as much detail as you did. I know this episode is going to be so beneficial for so many of the listeners. I'm just curious if there's anything that we haven't covered, or if you think about the woman who's listening whose partner has been struggling with these fertility challenges and now feels a little bit more armed with information. Is there anything else you'd want her to know?
So one other thing I would say is, I would say two things. Number one, I think in general, male infertility can be a big blow for men. It's very sort of, not for everyone, but for a lot of guys, it's very emasculating. So, and most guys are really trying. Most guys want to make their partner happy. So in general, be kind to your husbands. Try not to sort of point the finger and blame them, because really you guys are a team. But then the flip side to that is I see plenty of guys who just want to get checked, and when they get the sort of clear that everything that every stone has been turned, that we've looked, we've got an exam, they've got hormones, they've got semen analysis, DNA test, and everything is good, they are so happy, and they sort of go home feeling like they're the all-star quarterback. So I think getting checked is a great idea, but then also just women, be kind to your husbands.
Mm-hmm. Yeah.
I shouldn't say husband, partner. Partners.
Well, yes.
Relationships come in all different colors.
Yeah, no, definitely. I think that, it's on the one hand, I think women have every right to be frustrated. Like sometimes you might struggle just to get your partner to take a multivitamin or something. And for some women, it can be really frustrating. Like, I'm doing all this stuff and you won't even do this. And for some women, it's hard to even get their partner to be tested. That can be a struggle. But at the same time, it's like what we talked about before. If you're in a relationship with somebody, it's like give and take. You have to meet them where they're at and be kind. Yeah. So that's amazing advice, amazing words to end on. Dr. Samplaski, thank you so much for being on the show. Honestly, my brain is still spinning. I really appreciate the depth that you took us through with all this information today.
Well, I appreciate you inviting me to talk. I am passionate about helping couples have babies. I love that these resources exist for couples. So I really appreciate your taking an interest in Male Factor and having me speak.
Well, I'll make sure to link to some of the research studies that you've published in the show notes page. Is there anywhere that you would like to direct the listeners to learn more about you and what you do? And also, could you share where you're located? Because I know some of the listeners are going to be in your hometown.
So I practice in Los Angeles, and within Los Angeles, I go to a few different fertility clinics. I'm in practice at University of Southern California. You go to I can provide you with my website. But so if you just Google Mary Samplaski, University of Southern California Urology, you'll see my picture and a link to schedule appointments or the questions. In terms of resources, American Society for Reproductive Medicine has a lot of really great online information for patients. So if you Google reproductive health, it links you to American Society for Reproductive Medicine for the patient list of resources. And there's a host of different topics. This is high quality, unbiased information that, there's not, let's say, opportunity for financial gain. So those are great resources for patients.
Wonderful. Well, I'll make sure to link the resources that you mentioned as well as your website. So for the listeners who are on the go, they can just head over to the show notes page and get that information. And I just want to thank you again for being here. I really appreciate it.
Well, thank you for having me, Lisa. Have a wonderful rest of your day.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/305. I hope that you enjoyed today's interview with Dr. Samplaski. I mean, it was just jam-packed with so much important information, and always refreshing to have medical doctors on the show who are really investigating and working with their clients, as Dr. Samplaski put it, to achieve their goals. One of the parts of the episode that stood out to me was when she said, it depends on my client, like my patients, their goals. Most of my patients don't want to use artificial reproductive technology, and not all couples have the means to do that financially. And so one of the reasons why she's thoroughly investigating these situations for her patients is to really help them, to support them to achieve their goals, which would be to conceive naturally when possible, and to really determine if there's something that can be done if there is an issue on the male side. And so hopefully this episode has just provided you with additional information, especially if you've been trying to conceive for quite some time and it hasn't been working. And what I always say is that even if you've been told that everything is fine, if your practitioner hasn't sat down to explain to you, the different parameters where your partner sits, comparing that to the low basic limit, and then also comparing it to what would be optimal for natural conception if that conversation hasn't taken place, then even if you were told that everything was air quotes fine, it's really important to get a hold of the test results. So call your doctor's office, make sure you have a copy of your test results, make sure that you have a copy of everything on your file, so that if you ever do seek a second opinion or seek a consult with whether it's a different physician, medical doctor, or a functional practitioner, somebody who's trained to look for the root cause situation, so that they can have a second eyes on that same information and perhaps give you additional information. Without exception, all of my clients who I've worked with who've been told that everything was fine, their practitioners typically have not actually sat down with them and explained the results in any type of detail beyond just telling them that it's fine. So hopefully today's episode has just, continued to highlight and reiterate the importance of having both parties tested, thoroughly investigated. And if you're not satisfied with the information that you're getting, or you're wondering if there's more to the story, always worthwhile to consider, getting a second opinion. And so I just want to thank you for tuning into the show, for being part of the Fertility Friday community. If you were thinking of somebody the whole time and you were thinking, oh my goodness, she needs to listen to this episode, make sure to share today's podcast episode. You'll find the show notes page over at fertilityfriday.com/305. If you have really been enjoying the podcast, if you found the information to be valuable, if it has really opened your eyes to different things that you weren't aware of, or topics that you hadn't previously known about, I would really appreciate it if you left a review on Apple Podcasts. Leaving a review on Apple Podcasts, sharing your experience with the show, is one of the ways that helps people to find the show, and it also helps people to know what we talk about and what the episodes are like, what the information that we delve into. So just, find the Fertility Friday podcast on your phone, in your podcast player, and go ahead and leave a review for the show. I do read all the reviews, and I really appreciate all of your support. So we will be talking about male factor infertility and debriefing this episode in the Fertility Friday Facebook community. So make sure to join us in there. You can find us over at fertilityfriday.com/community. And so thank you for spending some time with me today. And of course, as always, until next time, be well and happy charting.